Let me now turn to Dr. Alex Johnson, the president of Cuyahoga Community College, Tri-C in Cleveland. Doctor, thank you very, very much for joining us. We appreciate it. How are things going?
Well, thank you very much, Governor, for having me. And let me extend my sincere appreciation to you and to Lieutenant Governor Husted and to Chancellor Gardner and to my dear friend Jack Hershey from OACC for the stalwart and steadfast leadership through this crisis and supporting community colleges without fail. It's been a tremendous opportunity, I believe, to really showcase what we do and to ensure that students continue steadfastly. We have done essentially all that Dr. Fail has mentioned with mandatory health assessments, in some instances, mandatory temperature taking. Every student and every staff member that comes to the campus now must wear a mask. And I'm proud to say that throughout the summer and the beginning of the fall semester, which began this Monday, that no one has contacted any cases of COVID here at our sites. The other thing I will share with you is that we have created a significant relationship with Care Alliance, one of our healthcare agencies here, to ensure that our students, staff, and faculty and individuals in the community benefit from testing. And in fact, that's going on right now at our metropolitan campus. Among the things that I'd like to share with you is the importance of community colleges and continuing to provide support for workforce development. So throughout the summer, we had individuals come in that completed part of their programs remotely, come to the campuses and complete their hands-on experiences. The first instance of that was with our police academy. Back in early May, we had 40 individuals being trained for the Cleveland Police Department who completed their training just about a week or so ago with no incidents, and we're very, very delighted about that. That gave us an opportunity to outfit physically to accommodate other workforce programs and also some of our allied health programs, most notably nursing. The one thing I can say about our students, just as Dr. Fell conveyed, is that they are truly, truly resilient. And while we have not adopted a particular motto or term alluding to the crisis that we find ourselves in, we still are relying on our strategic focus on access, equity, and success. And when you think about success, our students and faculty moved quickly to remote instruction. They did an admirable job in converting to that, and the outcomes have been tremendous, including increased graduation rates, increased graduation numbers. You may ask this question later on, but I'm going to get out a little bit ahead of you and say to you that even though our students are really responding to our efforts, we still have gaps that need to be filled in terms of students returning to the institution. And those students are most notably our Pell eligible or economically disadvantaged students, our students of color, and in some instances, high school students who have not quite made up their minds about where they need to go. So we need to continue to provide support to them in the form of devices, broadband access, emergency funding, and the kinds of things that would round out their educational experiences.
Doctor, thank you very much. You told me, I think, if I remember correctly, when we talked before, you deal with 50,000 people in a year's time.
Yes.
Who are getting something from the college, getting a degree or getting additional training. You and I talked, though, about the difficulty if you do remote for welding, something like welding or nursing. And can you just briefly tell me how you deal with that? And
right.
you said you brought people back during the summer.
Yes.
So as we now go into the fall, you're still going to be able to bring some people in?
Yes, yes. And in fact, the idea, quite honestly, right now, Mr. Governor, we're at about 80% remote and 20% on ground. And that 20% is indicated to you earlier, is in our workforce area. So welding, for example, manufacturing, including mechatronics, which is a combination of different certificates.
Okay, you're laughing because I didn't know what that was.
I know, but that's okay.
That's why Dr. Johnson's laughing. So
that's okay. That's okay. And so we're doing all of that, but we also can do, I think, a really better job in two ways. Number one, if we can figure out ways that individuals can develop these skills remotely. And this morning, I had a great conversation with our Mayor, Frank Jackson, and he's talking about the concepts not artificial reality, AR, in order to impart training, and we're looking into that as well. And the other thing is having training locations within the communities called access centers. And as I indicated to you on the phone, we have established one already on the eastern side of Cleveland, on the west side at Esperanza, close to Metro Health. We're looking to establish one in the Slavic Village area, which is an important community. And we're also looking to expand on what we do in the eastern portion of the county up in Euclid. So I think more remote instruction and hands-on, and more community located centers like job hubs and access centers would be, I think, a great answer.
Well, that's great, Doctor. Thank you very, very much.
Thank you, sir.
Good luck this year and good luck to all your team. We thank them for the good work they do. Thank you very much.
For your support, Mr. Governor.